Hello?
Hi, Mr. Rosen. My name's Rachel. I'm one of the nurses here in the emergency department. Can you tell me your name and your date of birth, please?
Yes, it's Larry Rosen, May 4th, 1949.
I don't have gloves, so I'm going to pretend to put on gloves here. I just need to double check your medical record number against your wristband. Can you tell me your medical record number?
Yes, 7866-1438.
And do you have any allergies to medication, food, latex, anything
Just
like
the
that?
food.
What food allergies do you
Dairy.
have? You have an allergy to dairy. What happens when you take dairy items?
I break out in a rash.
Okay, wonderful.
It's not wonderful.
So I'm looking at him. He doesn't appear to be in any general distress. His skin color is pink. He's warm and dry to the touch. His body is symmetrical. His legs are symmetrical. Hands all are symmetrical. Can you smile real big for me? Face is symmetrical as well. Can you tell me what year it is?
2018.
How many quarters are in a dollar?
4.
And who's our president?
Oh my God. Oh, Trump.
Perfect. So this
Yes.
patient is alert and oriented. He knows where he's at.
And telling jokes.
And he can tell jokes.
Yeah.
I'm going to just double check your IV site and make sure there's no redness, puffiness. It doesn't hurt when I touch it.
No,
And when I flush it, there's no problems with it.
no.
Perfect. So I'm going to check your hair, your scalp, your whole general appearance. There's no breakdown that I see on your elbows, on the back of your calves, or the back of your heels. Everything appears to be intact. Again, you're pink, warm, and dry. Your cap refill is wonderful. It's less than 3 seconds. Let me take a peek at your toes. Your cap refill is great in your toes as well. Now I'm just going to take a look at your head. I'm going to look at your eyes, your ears, your nose, your mouth. I'm looking for anything kind of abnormal. His pupils are equal and reactive. He has no drainage coming out of his nose. Open your mouth for me. His mouth cavity is moist. His ears are great. Neck is wonderful. Any sore throat, difficulty swallowing, nothing like that? Great. Any trouble breathing or chest pain today?
No,
So I'm looking at him. He's not using any accessory muscle use. He doesn't appear to be in any respiratory distress whatsoever. Looks like his respiratory rate is normal at this point, about 18. I'm going to take a listen to you. You take a deep breath for me. And out. Again. Once more. And again. And I'm just going to listen to the back of you as well. Perfect. And one more time. Good job. I've got your blood pressure at 135/78 and your heart rate's 80. You're breathing about 18 times a minute and your oxygen saturations are 99. All of those things are within normal limits. At this point, if I had an incentive spirometer, I could teach the patient how to use one. There's not one handy, so we can verbally discuss it. I am going to go ahead and assess his cardiac system. I'm going to check his carotids. I'm going to feel one side of your neck and then the other. We're assessing for pulses. I'm going to listen as well, listen for bruits. I don't feel any abnormalities on that side. Nothing on that side as well. I see your wrist. I'm going to check your pulses. Got a great radial pulse on this side. A great one here. I'm going to check your feet. He's got a great pedal pulse on both feet. And then I'm just going to take a listen to the carotids real quick. Both of those sound great. I'm going to listen to your heart sounds as well. I'm going to listen in all the different positions on your chest. I'm going to be listening to the second intercostal space. Erb's point is your third intercostal space, your fourth intercostal space, and your fifth intercostal space. They're just listening to different heart sounds that you have. can also do the mitral area. That would be the fifth intercostal space listening to the mitral valve. And I'm gonna have you go ahead and lay supine and ask you about your GI system. Have you had any nausea, vomiting, diarrhea lately?
No,
Any belly pain?
no,
No belly pain whatsoever. Do you mind if I lift your shirt up? I'm gonna
That's fine.
inspect your belly. Any pain when I palpate your belly?
no.
No pain whatsoever? Perfect. I'm gonna take a listen. I'm gonna listen for a total of 5 minutes in each quadrant. If nothing was heard, but I should only have to listen for about 30 seconds in each section. The right upper has active vowel sounds. Right lower as well. A little more hyperactive on the left. Any problems going to the bathroom, urinating lately? No burning, no frequency, feeling like you have to go again shortly after you've gone the first time?
No.
Okay, phenomenal. And no pain on urination?
Oh, no.
Okay. One of the things that we check on patients is ins and outs of strict eyes and nose on some patients. A patient that would be in congestive heart failure or was getting a diuretic would have strict eyes and nose. So one way to check urinary output and kidney functions would be to measure his constant urine output on this patient. So I'm going to check all 4 of your extremities. I need any pain or anything, any discomfort, swelling at any of your joints. Any problems with your left arm? No problems with the bending, nothing like that.
Nothing
no hurt,
with
no
the
pain
arm,
in your
no.
shoulders. How about your leg and your hips or your pelvis? Any pain there when I push down and in?
Nope.
Any pain on palpation of your legs?
Not on my legs.
No swelling noted, no edema in either foot or lower extremity. How about your right arm? Any difficulty over there? Any problems with it? No numbness, tingling, different sensations? It feels the same when I touch you on both sides?
Yeah, that feels the same.
And how about down here?
Feels the same.
Perfect. You go ahead and squeeze for me. Squeeze my hand. Squeeze, squeeze, squeeze. Perfect. I'm going to have you put your hands up like Superman. Close your eyes. Leave your arms that way. Perfect. Turn your palms up for me like you're carrying a pizza box. Keep them up. Good. Great. Go ahead and put those down. I'm going to have you push against my hands. Can you push down like you're pushing on a brake pedal? Push, push. Good. Pull your toes up towards your nose. Perfect. All right, Mr. Rosen, that's the last of my assessment for today. Is there anything I can do for you? I'll make sure the call bell's in reach. The bed's in the lowest position. You have access to a light, a water cup. Is there anything else I can do for you today?
No, I'm fine.
Okay, wonderful. All right, your call bell's right there. If you need anything, my name's Rachel. Go ahead and hit it, and you can ask to send your nurse in, or you can just ask for Rachel herself.
Okay,
All right, I'll be back to check on you in a little bit.
thank you.